Hey everyone, I'm Carson McKoon, and I'm here to talk about increasing healthcare access in rural Virginia. So, based on a 2019 survey, the poverty rate in rural Virginia is a pretty high 16%, and 120 areas and counties in Virginia are considered medically underserved by the Health Resources and Services Administration. I've seen this firsthand. Um, I had I worked at a rural elementary school during my undergrad years, as well as volunteered with free health clinics in rural areas of Virginia provided by Remote Area Medical, an image of which you can see here on the slide. And I want to be a physician. I want to be out in the world, hands-on, helping people who need it the most and who can't access it as consistently as others who have better locations, better financial resources, etc. During my interviews, what a lot of people said is that it is hard to physically reach clinics and hospitals. So the image here I got from the New York Times, and as you can see from the label on it, these areas are marked for people living outside of a 30-minute drive from the nearest hospital. So as you can see in Virginia, there's, especially in central and southern Virginia, there's a pretty large amount of people who are not able to reach a hospital within 30 minutes. And that really limits treatment options and worsens the health status of people living there. Additionally, people are very wary of health services. One person said that people often think that they're going to charge you for things you don't need, they're overcharging you, or they're fearful of just the services themselves. And then finally, a lot of it is just kind of stagnation. People just see it as it's just the way that it is and don't really see anything changing. So in response, I wanted to look for something that could help bring healthcare to the people rather than trying to bring people to the healthcare. So with talking with different people, especially Bryce Burnett, we kind of agreed that one way to do that is through telemedicine. So he's a tech guy himself, so he was all about increasing website and video call access. But at a more basic level, telemedicine could even just be through the phone. Much of these areas don't have high rates of internet access, so having the capability to provide services just through the phone is very necessary as well in order to reach a maximum audience. And telemedicine is cheaper than in-person appointments. It's easier to access, as I've mentioned, particularly through the phone, but additionally for those who do have internet access, it's a lower commitment. You're not traveling to get there. You're not in the social setting of having to interact face-to-face with a physician. And finally, it's something that you can advertise. You can distribute flyers. You can incorporate it into education, or you could introduce it at churches. There's a lot of different ways that you can present this as an alternative that can help get to the people quicker, easier, cheaper. I want to help patients in rural Virginia with structural and/or financial barriers to have increased access to quality health care, because I've worked with children myself and I've worked with underserved populations at the RAM clinics, and I've seen the damage that a lack of consistent care can have on individuals and entire communities. And in the long run, I want to be a physician. I want to be somebody who can provide that hands-on access and that quality care. But to get there, it's important that healthcare is accessible. So increasing telemedicine access in rural Virginia should provide a means for more patients to receive the care that they need and start building the bridges between those populations and healthcare.